What has changed since we last spoke?
Since we last spoke, more social distancing has definitely been put into effect just around the city from what we've noticed. Especially and post coming out on social media, I feel like the city is responding well, definitely stepping up its message to be separated. In terms of the medical hospitals and the medical systems around, there's definitely become a tightening on how many, on their protocols, how many patients they're allowing. Some hospitals I know are allowing only one visitor at a time. Some are even switching to none, I believe, at this point. Testing has definitely increased throughout the city from the reports of the Department of Health, and cases have started to increase as well throughout the state of Florida. So I think we went up from about 46 to 136 confirmed today.
Doc, is there anything in particular you want to emphasize to people? Because I've talked to several people and I've heard, I don't think it's as serious as they're trying to say it is. I've heard some people who honestly believe it's as serious as we know it is going to get because the top officials are saying, health officials are saying, we have not seen the worst yet. Is there anything in particular you really want to convey to our viewers about this coronavirus?
About this coronavirus, what I do want to say to the viewers is that yes, it is spreading like wildfire. Not at this point, but it could if distancing. We need to practice good hand washing. That's very important, and we keep pushing that message. Wash your hands. Don't touch your face. Give people who are sick a few feet of space coming into them. In terms of how bad this can be, there's two ways to look at it. For healthy people, you will feel sick. You will possibly be excluded from work. But what we want to do with the social distancing, even if it won't affect the general healthy population, is we're trying to protect those in the population who are elderly and immunocompromised. And that's kind of why the message of social distancing is going out, because it may not affect somebody like myself, but if I get sick and then I go into a grocery store and pass it on to an elderly person, the effects they may feel are much greater. So that's what we're trying to pass the message on and educate to, is why the importance for staying at home if you're sick, and just only go to the essential places at this point for the time being.
Does this virus live on paper? And if so, how long?
Again, the studies are still coming out. There are some preliminary studies from the British Medical Journal, along with partnered with Yale, that still need to be corroborated. But they say for a few hours, possibly. But again, this is preliminary, and it shouldn't be used to affect any medical decisions. But they are doing research as we speak into it to learn the life on surfaces. The CDC has put out guidance that says they don't even know how contagious it is or how feasible it is to pick this up off a service at this time. So I think their main concern is the person-to-person contact through close contact.
With that being said, and with nursing homes, people not having access to see their loved ones, can it be spread, you think, through sending cards or letters to our loved ones who may be in nursing homes?
I do believe that it is safe. I'm sure that you still want to probably wash. If you're feeling sick, that's when you probably want to consider maybe waiting till your symptoms come back a little, just until there is research saying how long it will or will not last on a surface. But if you're a healthy individual and you're just being prevented from seeing your loved ones due to social distancing and them being precautious, trying to keep everyone healthy, I don't see the issue of writing a letter, because you're technically, if you're not experiencing symptoms, more than likely you're not going to be shedding the virus onto other surfaces. So if you're a healthy individual, I don't see the harm in sending letters to your loved ones, because I understand it is hard not being able to see them at this time at certain facilities.
Obviously, we're going to have a lot of kids out of school. Some school systems have closed their schools, others are experiencing spring break. What should our young folk practice during the spring break? Should they stay away from crowded bars, things of that nature?
Yes, that is the messaging that is going out to everybody. We definitely want to avoid large group gatherings. We want to, because this is the perfect opportunity when we're packed shoulder to shoulder for one sick person to easily spread it to multiple people. If they're coughing, sneezing, if they have a runny nose, that they're accidentally bumping into you, because they're just not focusing on continuously washing their hands. So large group gatherings for sure. And then other settings, such as going to packed grocery stores, if they're completely packed, give the person in front of you a few feet of space in the grocery line. We don't have to stand shoulder to shoulder on top of each other. You don't have to give them the 6 feet if they're not looking sick. But if somebody is sick, right now the CDC is saying that it can spread up to 6 feet. So give them about 6 feet if they are looking to sit in social spots.
I had my daughter, I had to take her to the dentist office not that long ago to get her teeth cleaned, and I was listening to the dentist talk to some of the folks in the office, and they said at that time they were having trouble being able to find masks. Do masks protect you from the coronavirus?
Yes, so surgical masks are good against the coronavirus, as are N95s. This has been put out by the CDC, so you don't have to. The N95s are the ones with the finer filter that at first they were saying those are the only ones that will protect you, but the CDC, with more research, has come back and said yellow surgical masks are also just as effective, and you just also want to make sure you protect your eyes. So that's what's going on in hospital settings, is people are using face shields, but if for the general public, a yellow surgical mask will be just fine. And in terms of shortages, we have not heard of any. They're on what we call allocation, which means our supply will come in as it has prior to the COVID outbreak. So there's still no reported shortages that we know of at some of the facilities in the city. We're still getting supplies of masks as needed.
I was going to ask you if you thought this virus would wrap up anytime soon, but the President of the United States, Donald Trump, wrapped up a press conference not that long ago, right before we came on. He said that this thing could run through June, July, and August. When you hear that as a medical expert, you think what?
So my thoughts are that it's just the long-term effect. What we want to do is have if it runs that long, we're going to see a lot of people get sick. What we do want to emphasize is that the people showing up to the ED to the emergency room, emergency department, are the ones who need treatment. A lot of the facilities around are being inundated with people who have a runny nose, a fever, but are perfectly fine. They're able to walk and drive themselves there. What we want to emphasize is the emergency department is for those who are in need of urgent medical attention, who may need to be admitted to the facility, and also for those who are just coming for other reasons. And with healthy individuals, relatively healthy, with only mild signs of COVID-19, we educate them just to stay home, to social distance, to just hydrate themselves, manage the fever. And if symptoms do get worse to the point where you think you need emergency medical care, then come in. But if you feel like you just want to get tested because you want to know, that is clogging up the medical system currently. We want those patients to stay home and just treat themselves as long as they feel like they have it under control, just so we can get to the sicker populations, the ones who do need the care at the time.
We've heard the top medical officials in the country, also the CDC, saying that we have not seen the worst of the coronavirus yet. Are our hospitals prepared?
For right now, every hospital that we work with, that we speak to, our infection prevention groups meet, they're managing. We have not been overrun yet, as the reports are saying, or they're out there, rumors are saying. We are managing. We are capable of taking care of these patients, and we still have other patients coming in as usual. We're able to take care of everybody. It is causing we just have to think a little bit more critically of when they come in. If they have symptoms, we may want to put them on isolation just to make sure we're protecting the staff from potentially exposing themselves. But otherwise, the hospitals and medical facilities are actually very well equipped and still functioning at full capacity.
If you come in contact with someone who has the coronavirus, is it guaranteed that you'll get it?
It is not. This is not 100% guaranteed. So the way a virus spreads essentially is if you pick up the vector, the virus, and then you needed to come into contact with a mucous membrane or a part of your body where it can essentially get into it. So if somebody who had it sneezed in your hands and nothing else, and you washed your hands, you could wash it off your hands, and then you could touch your face and you'd be fine. It has to get either. So again, it's like somebody sneezing in your mouth or sneezing towards your eyes. Again, those are ways that a virus can get into your body, such as other bacteria, and that's kind of the route that it will go to for you to get infected. So as long as you, again, practice good hand hygiene and give people who are sick a little bit of space, you're not guaranteed to get it, even if you're in the same room with somebody with a confirmed COVID case.
Can you spread the virus before you develop symptoms?
Research is still being conducted into this. There may be a short window, but usually once you develop it, from what we are seeing, people are starting to feel pretty bad, like starting to feel symptoms right away. So you just want to make sure that right away, once you're starting to feel feverish, once you're starting to have the cough, the shortness of breath, right then and there before it even gets really bad. And once you just start noticing mild symptoms, that's when you're going to start critically thinking, hey, I should maybe stay home. Hey, I should maybe self-isolate and just see how this develops. If it gets worse, like I said, to the point where you need medical care, that's when you need to go in. But maybe wait till the symptoms actually go away if you can wait. I understand there are people who have job requirements who need to come in, but from our understanding, a lot of jobs are flexing their HR requirements of coming in to help people with social distancing.
Obviously, a lot of people find themselves in the same situation as myself. I have a wife, I have a daughter, who we obviously all live together. If one of us is to test positive for the coronavirus, should everyone inside of my home be quarantined?
If one person tests positive, there is still no set guidance, but you would think due to one person that the others may develop symptoms. What you would want to do in the home, if at all possible, is separate yourself from the rest of the family members and see how let your symptoms either, if, like I said, if you need treatment, go in or work their course, and once you feel better, and then have the healthier people try to maybe stay on another side of the building, house, wherever you're at, and see if they develop symptoms. Like I said, it's not guaranteed that just because one person has it, the next person will get it. But due to the close proximity that you're in, it is a greater odds. But again, you just want to you sort of want to evaluate the symptoms as you go.
You've given a lot of information over the course of this interview. If there are three key things, just three things you really want to get out to our viewers about the coronavirus, what are those three things?
First and foremost, wash your hands. Do that more frequently than you normally would. Second off, avoid large gatherings. Don't go to the bars if you can avoid it. Don't go into like a packed concert at this point. Third, if you are feeling sick, stay home. Call your employers, call your schools, let them know what's going on, because you are doing everybody a favor by staying home and preventing the spread. Even if you have something other than COVID, stay home until your symptoms either go away, or if you need medical care then and you need it urgently, that's when you want to go seek it. But stay home and sort of treat your symptoms as they come.
And I'll close with this one final question, because a lot of us have pets. Can pets get coronavirus?
Right now, there is no evidence that pets can get it. They haven't conducted research. Obviously, they're trying to more focus it towards how it spreads within humans. But right now, there's been no reports of it coming into pets, and that's because the mechanism of spread sometimes isn't the same across species. So that is why pets may be safe from this.
Dr. Marko Predic, thank you so much. And I remember those three things: wash your hands, avoid large gatherings. If you're feeling sick, whether it's the coronavirus or not, stay home.
Correct.
Thank you, sir.
I got a question.
Absolutely. You have a great day.
We got one more. Hold on, one more.
Oh, absolutely.
Doctor, I have a question. I have a 1-year-old son, and he constantly puts his hand in his mouth. Is it a possibility that he may be affected by this coronavirus, and if so, can he pass it to me through that way?
Sorry, can you repeat the last part of that question? There was a bit of static.
Being that he's 1 and he's constantly putting his hand in his mouth, is he capable of getting it and spreading it to the other members of the family, or infants are safe because of their immune system?
So the virus right now luckily it has not shown a tendency to infect the younger generation. So kids and toddlers and babies seem to not be as affected. It is they get this virus. Again, due to them being younger, their immune systems may be able to respond better. But yes, essentially every human has the ability to contract it and spread this virus. But as he is 1, you want to try to keep him away from sick people, try to keep him at home, or maybe if you're going out, try to just keep your distance away from individuals who may look sick, because usually he won't go out to places, especially being 1, where he could contract it as easily. So it'd be more feasible that somebody brings it into him. So again, like I said, practice good hand hygiene, and if you're sick, maybe reduce the interaction.
Thank you, sir.
Absolutely.
Have a great day.
You too. Have a great one.
All right, bye-bye.